Hi, thank you for joining me today. My name is Laurel from Hepner Group, and I've been helping people make their Medicare health plan choices for nearly 40 years. So today I'm going to talk to you about Medicare. It's going to be really high level, but I'm going to give you some important information, some things you need to know before you enroll in Medicare and sign up for a Medicare health plan. So what we're going to talk about is what is Medicare, who's eligible, how to get enrolled, what's Medicare A, B, C, and D, what are some plans you can get in addition to Medicare, and some important timelines. So Medicare was developed in 1965 by the federal government to provide health care coverage for people primarily 65 and older. But they've expanded the eligibility, so now there's a lot more people eligible for Medicare. So if you are turning 65, you're eligible for Medicare on the first of the month of your 65th birthday. If you are born on the first, then your Medicare eligibility date is the month prior. If you're disabled, you're eligible for Medicare on the 25th month. If you have end-stage renal disease, which is kidney failure, or if you have ALS, which is Lou Gehrig's disease. Now, in addition to one of those qualifiers, you have to be a citizen of the United States and you have to be a permanent resident for at least 5 consecutive years. Now, there's several ways to sign up for Medicare. But first of all, if you're already drawing Social Security and you've been drawing for at least 3 months, you will automatically be enrolled into Medicare. You don't need to do anything at all. But if you're going to wait and not draw Social Security right away, then you have to initiate your own enrollment into Medicare. And there's a couple different ways that you can do that. The easiest and fastest, most convenient way to do it is to go online. Go to ssa.gov. You create yourself an account and you can apply for Medicare right online. It takes about 15 minutes. If you want to do it over the phone, you can call the Social Security office. You can schedule a phone appointment. They will call you at a later date and time and they'll help you enroll over the phone. Or you can do it in person at a Social Security office, but you do have to schedule an appointment to do that as well. So no matter what option you choose, you cannot do it unless you're within 3 months of your requested effective date. Now, not everybody wants to sign up for Medicare when they first become eligible. Some people want to postpone it, and you can do that and not get a penalty if you meet certain criteria. So number one, you have to be covered under an active employer plan. Whether it's your plan or your spouse's plan, it cannot be COBRA. That employer has to have at least 20 or more employees, and the coverage needs to be considered creditable coverage. So if you meet that criteria and you want to postpone your Medicare, you can do that. You can sign up at a later date. You will not be penalized, but you will have to show proof to the Social Security office that you've had this coverage since you became eligible for Medicare. Now, there's several parts to Medicare. There's Medicare Part A, B, C, and D. Medicare Part A is hospital coverage. That covers 4 things. It covers room and board if you're inpatient, home health care, hospice care, and transitional care. Now, it doesn't cover everything in full. There's high deductibles, there's coinsurance, co-payments, and there's limitations on how long you can be in the hospital and in transitional care. There's no premium for Medicare Part A because you've already funded it through all your FICA taxes. And then there's Medicare Part B. That's medical insurance. So that's the doctors, labs, surgeons, x-rays, medical equipment, ambulance. Just like Medicare Part A, it does not cover everything at 100%. There's a deductible, and then there is coinsurance. So Medicare covers most eligible expenses at 80%. Medicare Part B has a premium attached to it. And in 2025, it's $185 per person per month. When I started in this industry, it was $17.80 a month. So there's a provision in the law that says if Social Security issues a COLA, which is a cost of living adjustment, then they can increase the Part B premium. And they do every year. It's also means tested. So if you make more than $106,000 as an individual or $212,000 as a married couple, then you will pay more than the standard Medicare Part B premium. All right, now there's Medicare Part C. It's also known as a Medicare Advantage plan. We're going to talk about that in a moment. Let's talk about Part D. So Part D is the prescription drug coverage. It was developed by Medicare in 2006, so they own it and regulate it, but the insurance companies administer it. So when you sign up for a Medicare Part D drug plan, you get it from an insurance company, even though Medicare owns it. But Medicare gives the insurance company all sorts of criteria, And one of the things that they say is, we will give you the standard level of benefits, but you as an insurance company, if you want to offer more coverage than what is standard, go ahead and do that, and then you can charge a premium for it. So every insurance company has different options to choose from. They all have their own provider network, different pharmacies that they want you to get your prescriptions from. They all have different copays and coinsurance for the prescriptions, and they all have something called a formulary, which is a list of covered drugs. So not all insurance companies cover the same drugs. This is really important when we're meeting with our clients. We want to make sure we get them on the right Part D drug plan that is suitable for them, that covers the drugs they take at the lowest copays and coinsurance out of their pocket. Now, there's two ways that you can get a Part D drug plan. One of them is considered a standalone drug plan. It is just a drug plan, doesn't have any medical with it. And the other is through a Medicare Advantage plan. So it will have both medical and Part D under the same plan. Now, as you can tell, Medicare does not cover everything. There are high deductibles, there's coinsurance, there's copayments, and most importantly, Medicare does not provide an out-of-pocket maximum, which is your financial safety net. So if you had just original Medicare, you would end up paying a lot of copays and a lot of coinsurance out of your pocket. There's never a time where Medicare says, we're going to cover you at 100%. So because of that, this is why people get insurance in addition to Medicare. And when you do that, you have an option between a Medicare supplement plan, also known as Medigap, or a Medicare Advantage plan, also known as Part C. Now, Medicare supplement plans are secondary to Medicare. They have no network, so you could use any provider nationwide that accepts Medicare. They are guaranteed renewable. That means they can never change your benefits on you, and they can never take the plan away. And they cover Part B drugs at 100%. Now, those aren't the drugs that you get at the pharmacy, like your cholesterol meds and your high blood pressure meds. Those are called Part D drugs. Part B drugs are anything that's infused or injected in a clinical setting. So an infusion drug would be if someone had cancer and they were getting chemotherapy, or if you were getting shots in your eye, that would be an injection like Eylea or Briovue or Lucentis. Those things are covered at a 100%. Medicare supplement plans do not include Part D, so you would get a standalone Part D drug plan, one that is suitable for you based on the prescriptions you take. They are guaranteed issue under a few circumstances. Number one, if you apply for a Medicare supplement plan, when your Medicare Part B starts, you have 6 months to enroll and be guaranteed the coverage. No health questionnaire. You could have had bypass surgery last week. You could currently receive treatment for cancer. If you apply within 6 months of your Part B starting, you're guaranteed the coverage. This is a real critical time frame for some people, because if they are taking expensive Part B drugs, or they're getting expensive treatment, or they have a history of medical conditions, they can apply in the 6-month window and be guaranteed the coverage. Now, if you apply outside of that 6-month window, in most circumstances, you will need to complete a health questionnaire. The insurance company will underwrite you, and they will determine whether or not they will accept you based on your medical history. Now, Medicare Advantage plans are completely different. They have networks. Some of them have in-network benefits and out-of-network benefits, but some of Medicare Advantage plans say you have to go in-network to receive coverage. Now, Medicare Advantage plans, they have deductibles, coinsurance, and copayments, and they cover all Part B drugs at 80%. They sometimes will include the Part D drug coverage built right in with the Medicare Advantage plan. So if you're on a Medicare Advantage plan that has Part D included in it, you cannot get a separate Part D drug plan. It will come with your Medicare Advantage plan. Medicare Advantage plans are not guarantee renewable, so they can change the benefits, they can change the network, and they cannot renew the plan sometimes. Medicare Advantage plans are guaranteed issue. So regardless of your medical history, they have to issue you the policy. So I talked about some timelines that were involved in Medicare supplement plans and Medicare Advantage plans, but Medicare Advantage plans have a few more timelines. And one of them is called the annual enrollment period. So if you're enrolled in a Medicare Advantage plan or a Part D prescription drug plan, and you want to make a change to it. Maybe your doctors aren't in network anymore. Maybe they changed your benefits. Maybe your prescriptions aren't on the formulary anymore. You have an opportunity to make a change during the annual enrollment period, which runs from October 15th to December 7th. And if you complete an application and submit it during that window, your change will go into effect on January 1. And then it used to be, that's it, you were locked into your health plan. But now Medicare introduced a new enrollment period. It's called the open enrollment period, and that runs from January 1 to March 31st. And this only pertains to Medicare Advantage plans. So if you want to change your Medicare Advantage plan during that window and you complete an application, your change will go into effect of the first of the following month. And then as of April 1st, that's in, they literally call it the lock-in period. You cannot make changes to your Medicare Advantage plan during the rest of the year unless you have some type of life-changing event that's called a special enrollment period. Then some people can change their plan during that window. Now, as you can see, these plans are completely different. It is not a one-size-fits-all. That is why it's really important that when you are going to make a choice on your health plan, that you sit down with a licensed professional to look at the whole picture and to help you choose a plan that is most suitable for you. We would be happy to do that for you, so give us a call.